I'm Dr. Dr. Hallier. I'm one of the anesthesiologists here at North Star Surgical Center, and I'm the medical director currently. A lot of patients have questions about what type of anesthesia they're going to have and are interested either in going to sleep or not going to sleep. And I tell folks that definitely is dependent on the type of procedure you're going to undergo. A lot of the procedures we do that are on a peripheral part of your body, like a foot or your hand, can be done with a block or with sedation and local anesthetic. So if you are opting not to want to go to sleep, we could do that for you. I tell everybody that, of course, when you do that, you're going to be aware of things in the OR, like our monitors, people talking. The other thing is that you won't be able to see, even though people think they'll be able to watch the procedure. We have to cover your entire body to protect the surgical site from infection. So you wouldn't be able to watch the procedure, unfortunately, if you opted for one of those types of approaches with a block. Going to sleep, of course, is pretty much what we do 90% of the time in all our operating rooms here or in other places, and it's a very safe procedure. People are worried that they won't wake up or they won't be able to tell us they're awake and when they're in the operating room, and that's really something that happens so rarely. It's not even very discussed anymore in anesthesia. When you decide to have surgery at North Star, one of our preoperative nurses is going to call and talk to you about your health questions and answer things for you. And at that time is a great time for you to ask them about anything you're concerned about with your anesthesia, particularly if you've had difficulty or other problems. And of course, if they can't answer any of those questions, one of the anesthesiologists that are all board certified here at North Star would be glad to call you back and discuss those issues with you and what kind of anesthetic we think would work well. Everyone gets to meet the anesthesiologist before your procedure, and they'll answer all your questions and go over the options you have for your anesthetic.